Researchers are trying to unravel the mystery of a rare lung disease. The lead researcher and our partners at Intermountain Medical Center found a genetic link to the life-threatening condition.
It was getting to the point to tie my shoes. I'd be out of breath.
Austin Hollingsworth from Preston, Idaho was an active 34-year-old. What he and many doctors didn't know was that Austin had a rare, life-threatening lung condition.
Chronic thromboembolic pulmonary hypertension, or CTEPH.
It's the complication of blood clots in the lungs that can be cured only by surgically removing them. Dr. Mark Dodson with Intermountain Medical Center says CTEPH is often under and misdiagnosed.
We'd expect around 10,000 cases of CTEPH a year in the United States, but the actual number of diagnosed cases is closer to 1,000.
For Austin, it took more than 6 months in and out of doctors' offices until he came to Intermountain Medical Center in Murray.
Was doing bear hunts up in the mountains, and 6 months later couldn't walk across his house because he's too short of breath, and he's 34 years old. Clearly, there's something wrong.
Austin is young and otherwise healthy, but Dr. Dodson says CTEPH symptoms are similar to COPD or asthma. Patients, especially those who are elderly, are often given that wrong diagnosis. Dr. Dodson led a research team to try to get to the bottom of CTEPH and found an underlying genetic link by collecting data from those diagnosed in Utah.
And we used the Utah Population Database, which is a very powerful genealogy database, which contains the genealogy data that was originally curated and maintained by the LDS Church when the Mormon pioneers arrived.
Through that genealogy database, Dr. Dodson and his team found 140 CTEPH cases in Utah and discovered patients clustered into common families.
On average, patients with CTEPH are much more related than we would expect by chance. These tend to be distant relationships, so most often second cousins or third cousins.
Austin's surgery was so complex he had to go to San Diego for the operation.
It's just like open heart surgery, but just like a step farther. They go right in your lungs, pull out the lining, pull out your blood clots.
Surgeons pulled out 2 antler-like linings from Austin's lungs. Austin is now on the journey to making a full recovery.
It was nice to know that there is a cure for it. It's just a matter of getting diagnosed. It's life-changing. I'm thankful for it.
Intermountain Medical Center is set to perform CTEPH surgeries for the very first time in September. In Utah, there may be 15 to 20 cases of CTEPH a year, but again, those numbers may not reflect the true cases. Researchers' next step is to identify the gene mutation and predict who is at risk for CTEPH to get a quicker and more accurate diagnosis for patients.